everyone. Hi, Jodie. Nice to have you here. We have Jodie Peacock, naturopathic doctor today, and she is going to be speaking all about getting pregnant with PCOS. So this webinar is being offered by Health Buddha, but is being sponsored by the Canadian Fertility Show. So thank you very much to Jodie and the Canadian Fertility Show for that. So we will get started. First off, I'll have you introduce yourself and just tell us a little bit about yourself, Jodie.
Sounds good. Thank you so much for having me today, Danielle. I really appreciate it. As Danielle mentioned, I'm a naturopathic doctor. I practice in Oakville. I've been in practice for about 17 years, and about 6 years ago created the Canadian Fertility Show. As kind of part of my practice, I do see a lot of couples that are dealing with fertility or individuals, and so saw kind of a need for like a broader base of education. So that was kind of the emphasis behind that. Certainly as part of practice, seeing lots of patients with PCOS. I have PCOS myself, so that's kind of near and dear to my heart, and one of the topics I love to lecture on because it is something that we can often manage, with diet and lifestyle changes.
Amazing. So I will get started. Just really, there are definitely some things that we can do for PCOS, but one of the questions that I hear a lot is, how much should somebody with PCOS be exercising?
Yeah, so that's a great question. It partially depends. There's kind of almost kind of two subsets of patients that have PCOS. So one subset very much kind of fall into the more traditional kind of category with kind of concerns around weight. We'll see kind of more the hirsutism, like kind of that unwanted hair growth, the elevated testosterone. Those patients we know definitely doing exercise 5 to even 7 days a week, 30 to 60 minutes has some real significant benefit for them. The other subset of patients tend to have more of a concern around their kind of stress or adrenal system, as well as those PCOS symptoms. So depending on how long kind of they have been untreated or undiagnosed, they may actually be in a position where kind of longer exercise and more exercise is almost detrimental to them, right? It's like too much. So with those patients, I tend to say, let's stick initially with more walking, calm yoga, not boot camp yoga, right?
Yeah.
Things to help nourish their system while we get kind of that adrenal piece back on track, and then we can often go back. But sometimes these are the patients that are like, I'm at CrossFit or I'm doing really high intense stuff, but they finish their exercise and they are exhausted, right? If you have to go and have a nap or are not good the rest of the day after you exercise, that is not a good fit. So I think it is something you have to talk to your practitioner about, but generally speaking, most patients, we want more exercise than they are currently doing.
Yeah, absolutely. And we know the importance of lifestyle, exercise, nutrition, stress management. And I know you spoke about kind of the two different types of PCOS, specifically in terms of exercise. And I'm sure you're assessing them with lab tests to know how are their adrenals, and is that and suggesting exercise based on what's coming back and obviously how they're feeling, right?
Yeah, absolutely. Yeah.
Okay, perfect. Now, obviously you're going to be doing a lot of the hormone testing that needs to be done with PCOS. But really, what other tests should people be getting that maybe they're not really familiar with, that they're not sure that they should be getting?
Yeah, absolutely. So, first of all, there are a lot of patients that are undiagnosed with PCOS. So, if you kind of think you might have it, but you're not 100% sure, the baseline things that we want to be looking at are your androgen levels. So your testosterone, your DHEA, getting a baseline for your estrogen and progesterone is also a helpful piece. Beyond that, looking at kind of that blood sugar piece. So fasting blood sugar is a very common one that most family docs will run, but most don't run a fasting insulin level. And it's fasting insulin where basically if you have not eaten and your insulin is still elevated, that actually promotes inflammation in the body. So we want to make sure that that's not happening. So running that fasting insulin, I think, is one that is not kind of a standard of care. Then also looking at like vitamin D levels. I mean, certainly in the wintertime, we know everybody in Canada is low in vitamin D if they're not supplementing, but how low are they? Right. And when we look at the research on PCOS and vitamin D, we know about 80% of women are deficient in vitamin D. And so this is where working with your health professional is really important, because the standard dosing of your 2000 IUs a day, for some people that puts them in a good range. For others, when we kind of look at the reference range, we want patients to be at least over 100. And I've had patients, they're taking 2000 IUs a day. They've been doing that for months and they're at 30. I'm like, okay, this is not this is not ideal for you. So, again, working with your professional on like how you're dosing, how you get it up, because that becomes a prescription, once you're beyond that 2000 IUs. The other thing I think is really important for patients to look at is their thyroid function. Because there is, probably about 20% of patients with PCOS can currently also have an autoimmune condition called Hashimoto's thyroiditis. So with thyroid, kind of the general screen that, your family doctor or nurse practitioner might send you for is a hormone called TSH. So that is a hormone that comes from your pituitary, tells your thyroid to make thyroxine or T4. With your TSH, if it kind of looks normal, they typically kind of stop looking any further at that point. But we know that there are a lot of patients that their TSH kind of looks normal, but then when we run the antibodies to actually see what's happening with their antibodies are really high. And especially if you want to get pregnant, we know high antibody levels and conception do not generally mix well together. So getting that baseline looked at, I think, especially if you're trying to get pregnant, running, your anti-TG, your anti-thyroglobulin, those two antibody levels to see, if they're not an issue, great, you can kind of rule it off your list as a contributor. But if they are high, then we need to make some changes.
Yeah, absolutely. And so these are all tests that when somebody comes to see you, you're able to, send them for, like you said, a lot of medical doctors will run the TSH, but not necessarily that full thyroid panel, right? So that's typically, what you're sending your patients for. So that's wonderful. Okay, so again, what you did mention, like, a lot of women don't really realize that they have PCOS, right? So maybe they've had some basic lab work done. A lot of times hormones aren't necessarily run and they're being told like, hey, you're okay, there's nothing wrong. Just some of those signs and symptoms. Can you just review maybe a few of those just in case, people are wondering,
absolutely.
like, hey, do I actually have it? Maybe not. What are the things that you see?
Kind of one of the most common things we'll see is an irregular menstrual cycle, or you're not getting a menstrual cycle, right? Like if you're going 3-4 months with no period, that may be an indicator that you have PCOS. One of the things that I see a lot of, because I work a lot with the athletic population. And so when you're kind of going through puberty, if you have PCOS kind of in that younger years, a lot of those women tend to be athletes because their testosterone trends a little bit higher, right? So it actually is a positive thing for a lot of those. And in those times, if you're training as a competitive athlete, like you're training every day, so that actually helps keep a lot of the symptoms managed for women. So a lot of times I find they'll show up at my office, late 20s, they've gone to university and now, they have a regular job. So they're now not training. And now all of a sudden they're like, I'm gaining weight like there's no tomorrow. I have sugar cravings like crazy. My period is all over the map. Maybe they're getting the hair growth piece, like kind of unwanted hair growth in areas where you don't want it to be happening. Those are and then acne is another really common symptom. So if, you were having those things when you were a teenager, you went to your family doctor and told them about them, oh, I don't have a regular period. Typically what happens is you'll get prescribed an oral contraceptive or birth control pill, right? So you take the birth control pill, now you're having a period every month. And until you decide you want to get pregnant, you may just stay on that, right? And then it's like, oh, I stopped the pill and now I have no cycle. So those are kind of the two categories I often find kind of when they show up in my office. It's either, okay, I was just, they may have been diagnosed with PCOS as a teen, or it may have just been, you have an irregular cycle and you have acne, take the pill. Like there might not have been much of a workup, but now that you're not on the birth control pill, all of a sudden these symptoms are all coming back, right? And it's like, well, we put a Band-Aid on it for those years, but now we need to actually fix the endocrine issue that's there for it.
Absolutely. Okay. So I guess another question, obviously, you're a naturopath. One of these questions why we're here is people say, okay, so I think I may have PCOS. Maybe my doctor's done some blood work, but what can I do about it? Right. Like, so what are some supplements or some things, dietary wise that you usually suggest?
Yeah, so definitely if you're in the kind of camp with the blood sugar piece, from a diet standpoint, like obviously working on reducing refined sugars, your carbohydrates in general. Now, you don't have to eliminate carbohydrates. So this is a common thing people sometimes are like, well, I don't want to be keto. I'm like, you don't have to be keto, but we need to be a little more choosy about which carbohydrates we're picking, right? We want things that are kind of natural whole grains, not refined. And it also becomes a little bit about quantity, right? So if you're going to have pasta, you're not going to eat 3 servings. But a lot of women find with PCOS also, there's a genetic SNP called FTO that it codes for kind of your ability to manage these 2 hormones called leptin and ghrelin that tell you you're hungry and you're full, right? Those often dysregulate. So, another kind of symptom that we might see is like, you can sit down and eat 1 cookie, 2 cookies. Oh, now I've eaten the whole bag of cookies and I still don't even feel kind of satisfied. That's definitely a blood sugar piece. And if any of those things are happening, there's a nutrient called myo-inositol that works really well to help kind of minimize those sugar cravings. The way that inositol works is actually by sensitizing your hormone receptors. So it doesn't actually force your body to make anything or shut anything down. It actually just makes your body more effective at using what you have. So with insulin, it makes those receptors work better, so that circulating insulin actually binds and gets the sugar into the cell. So now you don't have as much craving. With your estrogen, progesterone, testosterone, we see those all work more effectively. And there actually is research also with inositol helping with neurotransmitters as well. So those like kind of in your brain chemistry. So if you're on, medication for depression, it actually makes it more effective because now those receptors actually work properly as well. So, it's a quite interesting nutrient because it has lots of research on PCOS, but then also on anxiety and mood support as well. So that's a big one, I would say. If progesterone is low, so, from when you ovulate until your period, that's your luteal phase when progesterone should be your dominant hormone. If it's kind of not rising the way that it should be, we can experience more kind of PMS type symptoms. So the breast tenderness, the moodiness, you may, feel kind of a change in energy, those kind of symptoms. So obviously we can run a lab work to also check progesterone levels, but there's an herb called chase tree that will work really nicely kind of alongside inositol or independently of, depending on kind of what symptoms are there, to help regulate the menstrual cycle and support that progesterone piece. So that's one that I find, in a lot of patients with PCOS can be quite helpful. Obviously, if they're on the adrenal side of that, looking at adaptogens that are going to help support and nourish that stress and nervous system. So ashwagandha is one I find I really like because it kind of helps from a stress standpoint, but it also is really supportive for libido. So if you're seeing kind of low libido, concerns, which, often when we're dealing with fertility, that does become more of an issue. It can be really, a great support from that perspective. And again, it can work well alongside a chastery or an inositol, depending again on where you're landing. So those are probably the three more common starting ones. NAC would be the last one that I think I like to really bring up, because from the traditional medical standpoint, with kind of more of that insulin-based PCOS, there is a pharmaceutical called metformin that often will get recommended for patients. And it works great for some people. For other people, it causes a lot of digestive upset and they just don't tolerate it very well. And there was a trial where they actually compared using metformin to N-acetylcysteine in PCOS patients. And they actually found at the end of the trial that they had kind of equal glycemic control. They saw good embryo or good egg quality from patients, and it tends not to have that kind of side effect profile that you can get with metformin. So that would be another one I would definitely encourage people to talk to their naturopath about, for sure.
Yeah. Amazing. Wow, that's a lot of great information. So I'm sure that's going to be very beneficial. Yeah. No, that was wonderful. Thank you. Yeah. So you know what? Obviously you're talking about getting pregnant with PCOS. And is this going to be a topic at the upcoming Canadian Fertility Show? Is it on the roster or?
It isn't right now, actually, but okay. we probably will have somebody speaking on it for sure. We do have lots of like kind of an IVF diet lecture that's scheduled. There's kind of acupuncture and TCM and helping you get pregnant. And then we do have quite a number of kind of professionals outside of the naturopathic field also educating patients. So, like IVF 101, looking at, egg donors and what that could potentially look like, surrogacy. So kind of different topics that, depending on where you're at in your fertility journey, whether you're at the beginning, there's lots kind of to help you support. And if you're kind of well into your journey, also still, lots of beneficial information that you'll be able to get out of it.
Great. And when we're going to talk about the Canadian Fertility Show a little bit now. Now, when is the show and where is it being held?
Yeah, so we're going back in person this year. The last couple of years has been virtual because of COVID. So it's going to be Saturday, May 13th at the International Centre near the Toronto Pearson Airport. So fairly central for anybody in Southern Ontario to be able to get to. And the tickets are on sale now. So we're really excited to have a really robust lineup of speakers, lots of great sponsors and exhibitors as well.
Yeah. So, and that's what I was going to ask you about. So when somebody purchases a ticket, they come to the show, and what can they expect? So what are they going to see there? What are they going to hear about? What's the whole, the show about?
Yeah. So it runs from 10 to 5. So when patients come or people come to the show, there's a trade show floor. So there's usually somewhere between 50 and 60 exhibitors. So the trade show floor, again, will kind of cover all these different facets that can touch. So there are multiple different IVF clinics, some from Canada, also some from abroad. So there's one coming from, Barbados, one, a couple from the US. So you can get a chance to kind of speak to professionals, not just in Canada, but also outside, which is nice. Then, different exhibitors around egg donation, sperm options, your kind of supportive care. So psychology, that piece, like that mental health piece, I think often gets very overlooked when it comes to fertility, because it is, it's a very stressful and emotional process to be going through. So making sure we have kind of those supports available, naturopathic doctors, acupuncturists, so kind of the spectrum of people that may be part of your fertility journey. And then there are 3 lecture rooms, so they kind of run throughout the day, again with that kind of variety of topics. They will all get listed on the show website. So if you go to canadianfertilityshow.ca, You'll be able to see kind of what speakers are coming, what their topics are, and help you kind of plan the day to make it, as beneficial for you as possible.
Perfect. Well, wonderful. Thank you so much. That was great. I think everybody got a lot of information. And like Jodie mentioned, you can go to the Canadian Fertility Show website if you have any questions around that. We will wrap it up. But Jodie, thank you so much for joining us today and answering all of the questions and just giving us some great information on getting pregnant with PCOS. We appreciate you being here today. So thank you.
Well, and thank you so much for running such a great topic, and thank you to Health Buddha for partnering with us to help get this information out there.
Wonderful. All right, everyone, have a wonderful day, and we'll see you at the next webinar. Take care. Bye.